Thank you, Mr. Chairman, and thank you for allowing me to wave on to this important hearing. Well, we're going to repeat it again. What we're here today is to address costs by increasing transparency and competition rather than price setting that we've seen happen with some drug prices or with this Medicare for all business. And that's the world I come from, the business world, very competitive, very transparent. Our clients, our contracts provided for audits and things like that, so that, that we hid nothing from them. And that's kind of the way the free market works out there. And what we have here is a little different. Mr. Adler, bill that I co-introduced that we're discussing today, the Drug Price Transparency and Medicaid Act, would stop the harmful spread pricing practices some pharmacy benefit managers use, where they under-reimburse pharmacies while overbilling state Medicaid programs. Last Congress, the Congressional Budget Office estimated a version of this legislation would save approximately $1 billion in federal dollars. Can you speak to the implications that the practice of spread pricing has on businesses and the benefit that the healthcare markets would see if we were to implement a ban on spread pricing across the board?
Sure. Thank you for the question, Congressman. I think it's hard to perfectly game things out, in part because these are private actors who will just try to come up with other ways to do very similar things. And you've already seen a lot of the big PBMs already kind of move away from spread pricing. I think an important thing just to keep in mind here is that, right, employers also often want, maybe not spread pricing, but they are, right, cost sharing is part of the thing, right? There are two sides of this negotiation here. So often the employer sort of wants part of the benefit design as well here. I do think transparency is useful here to know exactly what money's flowing where, and I think that can be useful, but I think that's sort of where more of the sort of benefits are.
Mr. Chairman, I've long been concerned with the lack of transparency in the healthcare industry, particularly as it relates to healthcare middlemen like pharmacy benefit managers. Can you talk more about PBM transparency and how we can restructure the current rebate system to be more easily understood by employers, plan participants, and beneficiaries?
Well, let me just thank you very much for that question, and let me just start off by saying that employers, even very large employers, are frustrated by the complexity and opaqueness of the rebate structure, and they need to have the information. They don't know what they don't know. I've repeatedly said that, but that's the issue, and that's why it's so critical for them to be able to have reporting from the PBMs about the revenue streams, to be able to find out that really they are paying for value, that their patients, that their workers are paying for value. And I think it's so important to enshrine this in legislation because, number one, employers need the certainty of knowing that this is there. They also need to know that there's the clear definitions in statute about what needs to be reported. And I think most importantly, the transparency needs to be robust enough that it captures the PBM business model, not just today, but how it's going to evolve tomorrow as well.
Well, I served on the Healthy Future Task Force, and I couldn't have any of those experts that we talked to could tell me how to peel the onion back and find out where all the money's going. I recently took a trip to Israel, and pretty much I talked to folks about their health care, and they were pretty happy with it. Currently, Israel spends less than 8% of their GDP on health care. We're close to 20%. Obviously, we're in a worldwide competition here. We need to be looking at where our health care dollars are being spent. Many attribute our increased health care prices in part to consolidation by merging hospitals and pharmaceutical groups. Health Subcommittee, can you speak to how the hospital consolidation and acquisition of physician practices impacts employers and why this is such an important issue to them?
Well, thank you so much. And it impacts employers because it impacts employees. It impacts costs. I mean, ultimately, that's what we're here today, is figuring out what those root causes of higher healthcare costs are and to address them. And consolidation, overwhelmingly, is fueling higher healthcare costs. So if we're going to really tackle lower healthcare costs at their core, which is what employers want, to be able to deliver high-value, affordable care for their employees, They care about consolidation. They care about Medicare policies that are fueling consolidation.
Exactly, the federal government. Yes. Thank you. Mr. Chairman, I'm out of time and I yield back.